Welcome to the deep dive. Um, Today, I want you to imagine, just for a second, that you are building a house.
Okay, a house. I'm with you.
Right. So you hire this absolutely incredible team of specialists to bring the vision to life. You've got, a brilliant plumber, a top-tier electrician, and a master carpenter.
Sounds like a solid team.
It does,
Okay.
right? But there is this massive fundamental catch to the project. None of these experts have each other's phone numbers.
Oh, no.
And, well, they absolutely refuse to speak to one another. So the plumber runs a major pipe right through the wall where the electrician was, just about to lay a vital wire.
I mean, that sounds like a structural disaster waiting to happen. The homeowner would just be left paying the price for that total lack of communication.
Exactly. And yet, when you step back and really look at it, that is often exactly what it feels like to navigate the modern healthcare system.
Oh, 100%.
You have all these brilliant, highly trained specialists, but they are operating in complete isolation. They exist in these rigid medical silos.
Right, like the endocrinologist rarely coordinates with the nutritionist, you know?
Yes, who never consults with the acupuncturist or, the physical therapist. The patient is ultimately left standing alone in the middle, trying to act as their own general contractor.
Desperately trying to patch the whole treatment plan together themselves. It's incredibly stressful.
It is. Okay, let's unpack this because today we are diving into a stack of sources detailing a place that decided to just tear down those exact silos.
Yes, and it is such a fascinating case study.
We are looking at a really detailed profile of the Berkeley Center for Reproductive Wellness. This is a clinic located in Manhattan over in Midtown East at 16 East 40th Street, and it was founded nearly 3 decades ago.
That's a long time to be doing this work.
It really is. And our mission for this deep dive is to explore exactly how this specific clinic became America's very first center to exclusively combine complementary reproductive medicine with conventional Western fertility treatments.
And I think, whether you are currently navigating the complexities of the healthcare system yourself right now, or maybe you're just fascinated by human biology.
Right. Or even just interested in how rigid industries change.
Exactly. If you want to understand how established industries can actually evolve, this clinic's story is essentially a masterclass. It serves as this blueprint for how breaking down traditional medical silos and, honestly, forcing those specialists to communicate can fundamentally lead to better outcomes for the patient.
So to really grasp the magnitude of what they are doing today, we have to rewind to the origin. We need to look at the baseline established back in 1997.
That's when Mike Berkeley founded the center.
Right. And his origin story in this specific field, it really comes down to one pivotal case early in his career. He was working with a 42-year-old patient who was trying to conceive.
Which is already a challenging age bracket in reproductive medicine.
Absolutely. The sources note that for this specific patient, all conventional options had been completely exhausted. They had hit a definitive wall with standard Western reproductive medicine.
And, hitting a wall in that context usually means a patient has gone through multiple rounds of standard treatments without success.
Right.
And the statistical probability of a live birth via conventional means has just dropped to a point where doctors often recommend stopping treatment. It is a profoundly difficult place for a patient to be.
It really is.
Yeah.
But through a combination of acupuncture and customized herbal medicine, Mike was able to support her fertility journey, and she ultimately conceived.
Oh, wow.
Yeah. That singular, profound experience completely shifted his professional trajectory. He decided right then and there that he was going to dedicate his entire career exclusively to reproductive medicine.
Which was a massive pivot at the time.
Huge pivot. And fast forward to today, every single clinician on staff at the Berkeley Center is a licensed, board-certified acupuncturist and a board-certified herbalist trained specifically in the physiology of conception, implantation, and early pregnancy.
Yeah, and Mike himself actually holds the title of Fellow of the American Board of Oriental Reproductive Medicine, which goes by the acronym FIBORM.
FIBORM, got it.
Yeah, and he didn't merely pass the exam to get that certification. He was actually instrumental in helping to design and implement the certifying board itself.
Wait, really? He helped design the board.
He did. That board now sets the rigorous national standard for acupuncturists practicing in the reproductive field. And on top of that clinical work, he also lectures nationally and hosts the Holistic Fertility Show podcast. Well, show to, disseminate this information.
Okay, so I have to play the role of the skeptical listener here for a moment.
Go for it.
Wait, is this really that different from going to a general acupuncturist? The kind of neighborhood practitioner who Treat your bad back on a Tuesday, help someone else with a migraine on a Wednesday, and just happens to offer some fertility acupuncture on the side.
What's fascinating here is the sheer power of pattern recognition. I mean, in any field of medicine, repetition and volume are everything.
Right, seeing the same thing over and over.
Exactly. When you visit a general practitioner for acupuncture, they might see, say, 3 or 4 fertility cases an entire year, scattered among hundreds of other random ailments like sciatica or insomnia.
Which is a totally different ballgame.
Completely. But the Berkeley Center exclusively sees fertility patients. They have processed an exceptionally high volume of cases involving in vitro fertilization IVF, where embryos are created in a lab.
As well as IUI, right? Intrauterine insemination.
Yes, IUI and natural conception cases over a span of nearly 30 years.
So the data set their clinicians are working with is just exponentially larger.
It is. When you observe thousands of reproductive cycles from the clinical chair rather than just a handful, you develop a depth of clinical intuition that a generalist simply cannot replicate.
You start picking up on things others miss.
Exactly. You start to recognize incredibly subtle physiological responses. You learn how specific body types and specific diagnoses react to the various hormonal medications used in Western fertility treatments.
That makes total sense.
That hyper-specialization, just focusing solely on the reproductive system every single day for decades, is what sets their clinical capability completely apart.
And because they have this massive data set of pattern recognition, they aren't just doing standard acupuncture. They've actually evolved their biology toolkit to include customized herbal formulas, targeted supplementation, and this really fascinating technology called low-level light therapy, or LLLT.
Yes, and we really need to emphasize the biological mechanisms at play here because the goal of these combined treatments is purely physiological.
It's not just like good vibes.
Right, no, it is grounded in hard, measurable biology, not abstract concepts. The research associates their specific acupuncture protocols with measurable improvements in uterine and ovarian blood flow.
Okay, here's where it gets really interesting because we need to visualize why blood flow is the defining factor here.
It's crucial.
Think of the endometrial lining, right? The tissue inside the uterus where an embryo has to implant. They have it less like a medical term and more like prepping soil before planting a seed.
Oh, I like that analogy.
Right. If the soil's dry, if it lacks blood flow and nutrients, the seed, the embryo, it just won't take. It won't root. You have to optimize that environment first.
And to push that soil analogy further, you aren't just, lightly watering it. You're fundamentally altering the physical and chemical environment.
How so?
Well, by using acupuncture to stimulate vasodilation, which is the widening of the blood vessels, you are actively delivering higher concentrations of oxygen, hormones, and nutrients to those reproductive organs.
So it's like opening up the floodgates for the good stuff.
Yes. This process physically alters the environment to make it highly receptive. It improves the quality of the developing follicles and creates that optimal, nutrient-dense lining required for the embryo to successfully attach and grow.
And then we have the low-level light therapy, the LLLT. The sources state they use this technology to support mitochondrial function within the egg itself.
Which is wild science.
So it really is. For a long time, the mitochondria were just casually referred to as the batteries of the cell. But think of LLLT's effect on mitochondria, like jump-starting an old car battery to give the egg the cellular energy it needs to thrive. The actual mechanism of how light changes cellular energy is just wild.
The mechanism is called photobiomodulation.
Photobiomodulation, that's a mouthful.
It is, but it's vital. See, as a person ages, the mitochondrial energy production inside their eggs naturally declines.
My battery gets weak.
Exactly. And this lack of cellular energy is a major, often overlooked hurdle in fertility because an egg requires a massive amount of metabolic energy to divide and develop into a healthy embryo.
So how does the light help?
LLT utilizes specific wavelengths of light that actually penetrate the tissue. Those photons are absorbed by specific enzymes inside the mitochondria, which physically stimulates them to produce more ATP.
ATP being adenosine triphosphate.
Yes, the actual molecular currency of cellular energy.
So they're literally delivering photons directly into the tissue to trigger a biological energy boost at the cellular level. That is unbelievable.
It really is. And what allows the Berkeley Center to be so precise with these interventions, to know exactly when to stimulate blood flow to the lining versus when to apply light therapy to the ovaries, is how they process patient histories.
Right, because they aren't just guessing.
No, they operate entirely within the framework of Western reproductive medicine. They look at the exact Western diagnosis.
So, for example, if a patient presents with diminished ovarian reserve, meaning a lower quantity and quality of eggs, the treatment protocol looks vastly different than, say, a patient presenting with endometriosis, right?
Exactly, because endometriosis involves inflammatory tissue growth outside the uterus. Those are two very different environments. They tailor the traditional Eastern interventions to address the exact physiological deficits identified by the Western medical diagnostics.
So if the science is this rigorous and they're tailoring everything to Western diagnostics, it kind of forces us to look at the other side of the aisle.
The Western doctors.
Yeah. How does the highly conventional, often incredibly skeptical Western medical establishment react to a traditional Chinese medicine clinic operating in their space? I mean, historically, those two worlds do not play nicely together.
They really don't. There's a long, long history of mutual distrust. Western medicine relies heavily on randomized controlled trials and pharmaceutical interventions, and historically, they viewed traditional practices as lacking empirical data.
But the sources reveal a completely different dynamic in this specific case.
They do.
Let's look at Dr. Joel Batsefin. He's a highly credentialed chief medical officer who first met Mike Berkeley back in 2003.
Right.
And Dr. Batsefin was apparently so struck by Mike's deep fluency in Western medicine, his understanding of the nuances of IVF, egg donation, and surrogacy, that when Dr. Batsefin opened his own clinic in 2007, he made an astonishing real estate decision.
This part is amazing to me.
Right. He deliberately leased office space right next door to the Berkeley Center, just next door.
He literally anchored his entire physical practice next to an acupuncturist just so his patients could have seamless, barrier-free access to that complementary care. I mean, that is a massive structural commitment to an integrative model.
It is. And he isn't an outlier either. The sources mention Dr. Stephen Samkudi, who is a professor of obstetrics and gynecology, holding academic appointments at both Temple University and Jefferson University.
Very prestigious.
Very. And he publicly calls Mike one of the most passionate caregivers he's ever worked with. He actually stated he trusts no one more with his own patients.
That is high praise.
We also see Dr. Glenn Chapman, an associate professor, who openly emphasizes his deep respect for the scientific rigor backing Mike's treatment recommendations. So how did an acupuncturist earn that profound level of trust from specialized reproductive endocrinologists?
To understand how he earns that level of documented trust from, data-driven REs, we have to look at language and vigilance.
Yeah.
The bridge connecting these two distinct medical paradigms is shared vocabulary.
We have to speak the same language.
Exactly. The sources highlight that Mike continuously studies Western medical literature.
He is literally reading the same journals the surgeons and endocrinologists are reading.
Right. So when a reproductive endocrinologist tells Mike a patient is starting a specific gonadotropin protocol, meaning the injectable hormone medications used to hyperstimulate the ovaries to produce multiple eggs at once, Mike knows the exact half-life of those drugs.
He knows what's coming.
Yes. He understands the impending estrogen surge, the potential side effects, and the precise biological timeline. And he uses that knowledge to tailor the herbs and acupuncture to mitigate the patient's side effects while optimizing the drug's efficacy.
He coordinates directly with the doctors.
He does. He isn't operating in a vacuum, hoping his treatments don't interfere with the pharmaceuticals. He operates as an active, integrated partner.
And the sources point out that because he spends significantly more face-to-face time with the patients during their weekly sessions, Mike has repeatedly flagged lab work or diagnostic gaps that warranted a second look from the Western medical team.
Catching those subtleties proves to the medical doctors that he is a vital asset to their overall treatment plan.
Right, rather than a liability or a distraction.
Exactly. He is an extra layer of clinical oversight.
So, if the biology is this sound, and the Western doctors are this bought in, it makes me wonder about the actual patient experience.
Which is arguably the most important part.
Right. The clinical side is clearly rigorous, but anyone who has navigated fertility treatments knows it is notoriously stressful. How does this clinical integration translate to a patient who is exhausted, overwhelmed, and just sitting in the waiting room?
Well, the first major factor is time. Fertility treatment is entirely dictated by human biology, not by our modern calendar.
The body doesn't care if it's Tuesday or Sunday.
Exactly. The specific implantation windows, the exact hours when a uterus is most receptive to receiving an embryo transfer, they can shift incredibly fast based on hormone surges.
A patient's body does not care if it happens to be Thanksgiving morning, right?
No, it doesn't. And to accommodate that biological reality, the Berkeley Center treats patients pre- and post-embryo transfer 7 days a week.
7 days a week.
Its schedule includes weekends, evenings, and major holidays. Patients are never asked to skip a clinically vital acupuncture session simply because it falls on a Saturday.
That is huge. And beyond the scheduling, there is the physical environment itself.
Yes, the clinic space.
Western fertility clinics are often highly clinical by necessity. They feature, bright fluorescent lights, cold stirrups, sterile rooms, and they induce a lot of baseline anxiety for the patient.
It's tough to relax in that setting.
Very tough. But the sources describe the Berkeley Center's Midtown East office as being intentionally designed as a beautifully curated, calm retreat. Patients regularly report that they actually fall asleep during their acupuncture treatments.
If we connect this to the bigger picture, we really have to acknowledge the immense physiological impact of stress.
It's not just in your head.
No, it's very physical. The sheer volume of cortisol and adrenaline pumping through a patient's body during a high-stakes IVF cycle is staggering. When the body is in a state of fight or flight, it naturally shunts blood flow away from the reproductive organs and toward the major muscle groups.
Preparing to run from a tiger, essentially.
Exactly. So by pairing their deep clinical knowledge with a genuinely relaxing physical environment, the clinic is actively lowering that nervous system response.
Regulating that stress is not just about making the patient feel nice, then.
Not at all. It is a crucial functional component of optimizing reproductive blood flow.
And the patient testimonials in the source material really anchor this reality. There is a detailed review from a user on Park Slope Parents who worked with Mike through an arduous IVF cycle and into her first trimester.
Oh, I remember that one.
Yeah. She specifically highlighted that he was the one who flagged specific medical tests that were crucial to discuss with her Western medical team. She ultimately had 2 successful pregnancies and 2 healthy babies after integrating his care.
That direct intervention highlights exactly how his vigilance serves the patient, by bridging that gap between the complementary care and the Western doctors.
There was another patient who shared a profound story on Google after enduring 2 failed embryo transfers with a completely different clinician.
Which is devastating.
It is. She transferred her care to the Berkeley Center, and by working closely with Mike through her subsequent egg retrievals and transfers, she successfully became pregnant on both of the transfers he supported.
Wow.
But what really stands out is that she credited not just his medical knowledge, but his emotional accessibility, noting that he was always just a text away through an incredibly dark and difficult process.
I mean, treating conditions like diminished ovarian reserve, endometriosis, and recurrent miscarriage takes a heavy psychological toll.
It really does.
They also treat polycystic ovary syndrome, PCOS, which involves hormonal imbalances that disrupt ovulation, as well as male factor infertility and recurrent implantation failure. Treating that massive spectrum of complex conditions requires treating the whole patient emotionally and physically.
So what does this all mean? When we zoom out and look at the entirety of this profile, the Berkeley Center represents nearly 30 years of successfully proving that a patient does not have to choose between medical traditions.
Right. You don't have to pick a side.
You don't.
Oh.
You can harness the profound physiological benefits of complementary practices, like the increased blood flow from targeted acupuncture, the boosted cellular energy from photobiomodulation, and you can marry them seamlessly with the exacting, data-driven precision of Western reproductive endocrinology.
It proves that when the plumber and the electrician finally look at the exact same blueprint and actually communicate, the structural integrity of the final build is infinitely stronger.
It really is. And for anyone listening who might be interested in exploring this integrative model for their own path to parenthood, the sources note that the clinic offers detailed consultations at their Manhattan office to review individual case histories and determine how this specific approach might apply to their unique diagnosis.
This raises an important question, though, one that really lingers when you analyze the success of this specific model.
Yeah.
We see how beautifully this integration works for reproductive medicine. We see a highly customized, hyper-specialized center where Eastern and Western practitioners communicate directly, respect the rigor of each other's science, and achieve incredible outcomes for patients who had previously just hit a wall.
Right. It's an incredible success story.
Well, why isn't this the standard blueprint for all of medicine?
That is a great question.
I mean, could this exact same collaborative, ego-free model be the key to revolutionizing how we treat other complex systemic conditions in the future, like autoimmune diseases or chronic pain or metabolic disorders?
It makes you wonder if they could do it for fertility. The potential everywhere else is just staggering.